Welcome back to Arise News Now. Health officials across the world are still working to get a grip on the Ebola outbreak. Centers for Disease Control and Prevention officials from the United States are in West Africa, and Director Thomas Frieden says the outbreak is much worse than he feared. Meantime, in Liberia, one of the hardest hit areas, bodies are indeed piling up, and health workers there say the disease is moving too fast to keep up with. Arise News' Kelsey Minor is working this story for us, and he is here in the studio with more. Welcome, Kelsey.
Well, Julian, thank you very much. There is widespread fear and anger across West Africa over what is the largest outbreak on record. Health workers are putting up quarantine tents, but even that isn't being done fast enough to contain it.
Outside high risk.
Doctors in Liberia in highly protective suits are racing against the clock, trying to get a grip on the Ebola crisis that's showing no signs of letting up.
The numbers is going up rapidly, faster than what we thought, forcing us to adapt our plans and our strategy on a daily basis.
The numbers are staggering. So far, more than 1,400 people across West Africa have died. That on top of the more than 2,600 who have been infected with the deadly virus since it was detected. And just this past Sunday, an outbreak was confirmed in the Democratic Republic of Congo.
It's very important to understand today this is more than an Ebola outbreak. Today we're facing a humanitarian crisis, and it's evolving in front of our eyes, and it's getting worse every day.
To Nigeria, where as a precaution, all schools have been ordered closed until mid-October. School officials not cutting any corners. They want to make sure preventive measures against the virus are in place before students are allowed back. And German doctors are treating the first patient there. A Senegalese doctor with the World Health Organization was infected in Sierra Leone. Already, 3 doctors have died after contracting the virus in that country, leaving officials with one explanation: the virus will get much worse before getting better. And word tonight that another American could possibly have the virus. A CDC worker has been flown back to the United States as a precaution. That worker was in West Africa surrounded by people with the disease. And Julian, officials say that worker will have to be monitored for 21 days also as a precaution.
Tragedy there. Kelsey Minor, thanks so much for that report.
Thank you.